The Koshi provincial government has allocated 62.5 million for equipment and human resources to expand services in hospitals. The provincial government has launched the My Health, My Responsibility campaign. It has been announced that mental health services will be expanded in all hospitals under the province, targeting individuals or communities with psychosocial problems. For the overall expansion of health services, Koshi province has earmarked 3.517 billion.
नियमित प्रयोगमा आउने र आकस्मिक अवस्थामा आवश्यक पर्ने बफर स्टक तथा निशुल्क वितरण गर्ने औषधि खरिदका लागि 3 करोड 61 लाख विनियोजन गरेको छु। खोटाङ जिल्लामा निजी क्षेत्रको साझेदारीमा जडीबुटी उत्पादन तथा प्रशोधन केन्द्र स्थापना तथा सञ्चालन गर्न 3 करोड विनियोजन गरेको छु।
Madhya province has announced a budget of 6.45 billion Nepali rupees for the Ministry of Health and Population. In collaboration with local governments, the province will implement the Chief Minister's door-to-door health service program. Awareness campaigns on natural medicine will be launched. Major infrastructure developments include the construction of a trauma center in Sirahas Gold Bazar, a regional maternity center, and a mental hospital in Mahottari. The Gandaki provincial government has put forward slogans like Healthy Heart, Beautiful Future, and identification and treatment of non-communicable diseases, the basis of a healthy life. The Gandaki government has allocated 15.2 million Nepali rupees for programs to identify, treat and manage non-communicable diseases and enhance mental health awareness. They have also announced plans to control communicable diseases, tuberculosis, leprosy, and HIV/AIDS. Likewise, 20.7 million Nepali rupees has been allocated for disease response plans, medical kits, and other medicinal supplies for diseases like malaria, Kala Azar, and dengue. The Gandaki government has earmarked 3.327 billion Nepali rupees for the Ministry of Health. The Bagmati provincial government, on its part, has announced plans to implement initiatives focused on specialized healthcare services. These include developing the infrastructure of provincial hospitals and deploying specialist doctors to remote areas. In Bagmati, the concepts of one district, one healthy city, and one local level, one model health institution program will be put into action. Furthermore, the One School, One Nurse program will also be continued. The Bagmati province's Ministry of Health has been allocated 3.968 billion Nepali rupees.
जन्मजात स्वास्थ्य समस्याको निशुल्क परीक्षण र उपचार गरिनेछ। बाल बालिकालाई विद्यालयमा श्रवण दृश्य दन्त प्रशिक्षण गर्न भविष्यमा हुन सक्ने बाथ रोग र मुटु रोगको निशुल्क स्क्रिनिङ गर्न आवश्यक व्यवस्था मिलाएको छु।
The Lumbini provincial government has allocated 120 million Nepali rupees for the purchase of health equipment and 30 million for medicines to be distributed free of charge. 100 million has been earmarked for the Safe Motherhood campaign to reduce maternal and neonatal mortality rates. Subsidies of up to 200,000 per person for heart valve and kidney transplants and cancer treatment have been continued. Lumbini province has allocated 4.95 billion rupees for the Ministry of Health. The Sudar Paschim provincial government has allocated a budget for upgrading services like laboratories, emergency services, and surgeries in all provincial hospitals under the Chief Minister's Health Sector Improvement and Nutrition Security Program. In Kailari and Kanchanpur, arrangements have been made for the identification, diagnosis, and treatment of diseases such as sickle cell anemia, thalassemia, and hemophilia. The Karnali provincial government has announced plans to develop Surkhet Provincial Hospital into a health science academy, launch a campaign to enroll all provincial citizens in the health insurance program, and enhance the effective supply management of essential medicines, quality health materials, and equipment in all districts. 10 million Nepali rupees has been allocated for treatment assistance to patients suffering from chronic diseases like cancer, heart conditions, kidney ailments, and Alzheimer's. Karnali province has allocated 5.77 billion Nepali rupees for the Ministry of Social Development. For Kantipur News, a report by Kripal Gautam.